Let's dive in.
So my
Kayla.
first question is, how has the COVID-19 pandemic affected public health in Zambia?
Thank you. So from my perspective, I think I look at it more not only on public health, but also just healthcare and the whole system. But with COVID, what I noticed, I think just starting that was somewhere 2019 and 2020, especially I think when we got into 2020, when we were getting the Delta, I think what I noticed is there was a more value added to public health. Previously, what I've understood in Zambia, we actually look at healthcare system more of the clinical part of the system as the most important thing. We want to treat, diagnose, and do treatment. Prevention has been really far behind the system of clinical care. So with COVID, I noticed that a little bit more, there was seriousness. We, like public health department, got more attention than previously. And we got even, I think, an increase in the number of doctors moving from clinical care to public health. And also, I think there was a larger move where we started involving more specialized, getting more nurses, getting more doctors to be interested in the field itself. And on top of that, I think the other aspect we can look at is the fact that it got shifted a little bit from the concentration which we've had, which are more of malaria and things like that. We started now looking at viruses from a different angle. And with the pandemic, we actually shifted. So we have now a problem that we're trying to clear because we were unable to handle COVID, handle all these other diseases that were there previously, the endemics like malaria, issues we have with diarrheal diseases, HIV as one of them. These were kind of pushed on a lower level, and COVID took over that, that important issue that we had to deal with. So all this funding that we're getting, all the support that was coming in was actually directed to COVID. So by the time COVID was kind of getting controlled and at a lower level, we now realize, malaria was out of control, because we had stopped those preventive measures. We had stopped the campaigns actually for prevention, the spraying, net use among pregnant women and things like that. And HIV also, the campaign against HIV was also kind of removed from the platform where it was replaced with COVID. I don't know if there's anything else. I think I'll hand over to you, Harmony. There's something else that maybe can be added.
Yeah, that's a great point. And I know that it comes up every time there's sort of a new focus or emergency. I remember when, the HIV programs were starting up, the family planning people were very upset because it was felt like you're taking nurses' time away from family planning and towards the HIV program. And so really, I think it's just a natural thing that happens whenever there is this huge push or huge focus, that all the other things that are running in the background, it's important to remember that there's a limited amount of time, a limited number of people. And so when you divert attention to one thing, some of the other ongoing work doesn't get the same support. And just to be kind of mindful of that impact. It's not a judgment about what's important or not. It's just, there are always trade-offs.
Yeah, of course. Thank you. My next question is, how has the pandemic affected mental health in Zambia?
Mental health has always been a place, I think has always been kind of, with our cultural beliefs and spiritual beliefs, mental health has always been a place where there's a lot of stigma right from the beginning. So it has never really been paid the due attention and importance in society, because it's hard for most Zambians to accept depression, to accept schizophrenia, to accept all these other aspects and all these illnesses and conditions that are found in mental health. So it's somehow through public health it's getting the recognition, the importance that it needs. And most of our patients who are suffering, and even their caregivers who have to take care of a loved one who is suffering with mental illness, they are always asking and crying out for more attention, for more specialties. You know, the stigma actually doesn't just end with the communities. I mean, it goes all the way to our universities. You know, we have a lot of we have a lot of professionals who do not look at psychiatry as a field that needs attention, because it's either when somebody is showing any of the signs that is not acceptable in a society, it's either they need help from a religious angle, or it's something that is basically ignored. You know, it's either a curse, it's never really a condition that starts with, that is derived from maybe health or medicine, biology, and things like that. So COVID coming in, I think it again goes back to how it affected healthcare system, how it affected Zambia. The push, the disbalance now towards mental health just became a little bit worse, you know, because COVID, if you remember the fact that COVID affected the clinical aspect of it, because we were really looking at the elderly, we were looking at hypertension, diabetes. Those were the comorbidities that were actually getting the biggest hit. So you'd find that the fact that there was no connection between mental health and COVID as an illness, it's been ignored for a while, and right now I think it's something that we're hoping can actually change. There's a bit more speak about mental health, about awareness and things like that. But to be honest, from my point of view, from my understanding, you know, and if I knew that usually actually there was going to, if I had just, you know, I spent a little bit more time, maybe yesterday I could have called a friend of mine. I didn't really, sorry, Kayla, I didn't go through the questions. But if I could have called a friend of mine who's in mental health, get maybe a better understanding. Right now, I'm doing my master's in public health. So we've had discussions around mental health, and I'm still feeling, from what I've seen, you know, I'm having my exams in November, so I've already done a lot. What I'm seeing already is that it's still mental health has no ear when it comes to you know, the government. We feel there is more important things that are going on. Things when mental health questions come in, also the churches come in to kind of help with what is regarded as a mental health, because they are looking at it as a spiritual attack or some demonic forces that are going on. So that split between religion and medicine makes it so hard to find an important space for mental health. I hope that answers your question, Kayla.
Yeah, thank you.
I think just to add, my understanding, you know, I know that different populations in the US were affected by COVID differently, and it also depends on where you were in terms of how locked down you were. So I know, you know, as the mother of 3 children, that my children were really affected by schools being closed and having to learn remotely. That I don't think was as big a problem in Zambia, because I think schools resumed much more quickly. And so the experience, I think, for young people in Zambia was not as severe as it would have been in the US on their mental health. And then I do know, though, you know, that, you know, elderly, I know at least a number in my family who are still much more hesitant about social engagements and social interactions, who still feel that they're at risk. And so their lives and their mental health, I would say, has really been affected by COVID in an ongoing way, because they still see themselves at risk. And I don't know if that's true in Zambia. What would you say, Nelly, about that?
Thank you for that, Harmony. So basically, I think from that angle, you've been right. You know, when we realized, to be honest, I think we took a little bit longer, not the government and not the health system, but the communities. We took a little bit longer to accept there was COVID. So with that delay, there was a delay in closing down schools, and there was an early opening in schools. And when you think about such things, there was really no proper isolation, because a lot of people, I think even up to now, people are wondering, is COVID that bad? Is it really there? And then on top of that, the fact that we were, I think the debate is still there, was COVID targeting maybe specifically, the rich, because you'd go to the more, sort of communities which underserved communities, the less privileged, you'd find that they would actually gather in such huge numbers, and then still the number of infections we got from there was not as huge as in the suburban and the urban areas. And that came, I think, from the travels back and forth, because this is a community that has actually got into contact with people who are moving a lot abroad. Because I'm sure you know this, Kayla. I mean, the first, to my knowledge, the first COVID we got was, I think, a Zambian who had traveled to France, came back, was diagnosed in Zambia that he has he had the virus. So when it comes to isolation, Zambians we don't do very well. So we never actually isolated that much, People don't gather, don't go to church. People actually rebellious for the first time. I mean, I was actually here, people are just saying, no, we will not do that. But I'm sure there was an aspect of that where a few people were, they actually locked down. I had a few clients who were Indians who actually took it very serious, because they know back home they were hit badly. So I had a few elderly from the community of Indians who actually had suffered a bit, that when they were able to travel, you could see the anxiety in them, you could see the desperation to get their loved ones because of those closed borders and the restrictions on traveling. But when you look at the youth and Zambia as a whole, I think it's possible, when it comes to appreciating mental health, diagnosis of it, it's possible people suffered much more than was realized. And nobody talked about it, and nobody came out to talk about it. So it's something that was probably missed, and still data is being gathered. But then when we talk about recall, the period has passed. People will not look at it seriously today as it was when they were going through that, It really come up with the right numbers and everything. And I'm sure other countries could have been affected much more. Their mental health was affected much more than we are even accepting or realizing in Zambia. Yeah.
Thank you. So my next question, how has the pandemic affected vulnerable populations living in Zambia? And by vulnerable, I guess I just meant just children and older people. How has that kind of affected them?
So if I can go ahead of Harmony on this one again, I don't know if you saw maybe the distribution and the numbers that were actually getting affected a lot. I think when I looked at the pediatric at the age below the age of maybe let's say maybe the age of 5, or maybe children, if we can even go below the age of 18. Since we were not having cases that much, and then when you talk about vulnerable people, the elderly, I find that, yes, we had issues, because even as a doctor working, by then I wasn't even in research, I was in clinical care. You would find that we were getting a lot of deaths in, the fact that there were all these losses going on, lives were lost. So it was actually unbearable seeing maybe a grandmother in 80 years old has lost a 40-year-old son or a 30-year-old, and it was rare. You find that the age group was 40 to 60. Those were the ones that were, and you find that above who were not being affected in Zambia, the very elderly who we thought were actually who just even the disease targeted more because of their immunity. In Zambia, we didn't get such a picture. The picture that we got was that was strongly painted was the diabetes and hypertension, because I was in the clinic, we're getting a lot of 40, 45 coming in, unable to breathe. 5 minutes later, they've gone. You can't pick any form of life. So we had a lot of those repetitions. And when a child comes in, rarely, I think I got one who was maybe 2 weeks, no, less than that, because the mother there was a history of the mother having COVID virus while she was pregnant with this baby. So such passing. So when you look at the vulnerable in terms of age, they were not very much affected, because in vulnerable, again, I'll go back to privileged and less privileged, The less privileged were not really affected. Very few of them were really losing. What I noticed, actually, it's the more privileged group that we're losing. So we had a lot of young people lose parents, lose the one who is the one they depend on, And so in Zambia, the place that was properly hit the worst was economically. We were actually hit really bad because it was taking out the age group that is a very productive age group. That's the one it was, attacking a lot. And you'll find this is the age group that Zambia has been fighting when it comes to lifestyle. These were people a little bit obese, overweight, what's this with diabetes and hypertension. So, and I'm sure some other numbers could help answer your question. But from my angle, when I was working in the hospital and ICU, the picture was different from what we're getting from the neighbors, especially the Western world.
Yeah, that's absolutely my understanding as well. And that, there was a lot of concern in the beginning when we didn't really know much about the disease. We're very concerned about children. As we learned more, we knew that the elderly were a particular focus, but just in terms of the people I knew then who did become affected, and sadly that we lost, it was as Dr. Mandona is saying, it's much more in the sort of midlife were the ones that were really most affected. So not what we anticipated at the beginning.
Thank you. So my next question, how was Zambia supported during and after COVID-19 by others?
This I can address a little bit. So UNC has a number of country offices. Zambia is one of them, and we also have an office in China, and in Malawi. And one of the things that was really heartwarming to me was to see all of these UNC teams pulling together at this time to help make the connections and buy PPE supplies and arrange shipments. And so the UNC China office was very helpful in buying and shipping PPE to Zambia. And we were also able to work with the infectious disease group to leverage donations of medicine to the Zambian Ministry of Health. We used our own resources as a department in OBGYN to buy oxygen concentrators. I think we found them in the UK and shipped them to Zambia to donate to the Ministry of Health. So I think it was, there was definitely a sense of helplessness, but trying to do the best we could to try to provide protective equipment and medicine and machines to help care for people affected.
All right. So I guess my last question would be, when it came to vaccines for COVID, when exactly when was Zambia able to distribute those, or when did they receive those to where they could distribute those?
Yeah, I know our office, so we were part of the CoVPN, which is an NIH trial network. So that was one avenue that we were trying to get vaccines in the country as quickly as possible. But I think that, because research takes so long to get off the ground and running, I actually think that what was the vaccine network? I think they were able to get vaccines in place much more quickly than anticipated, but I honestly can't remember the date. But it was early. It was not, I think, in getting vaccine access to Zambia. Of course, like everywhere else, there was a phased rollout with healthcare workers being prioritized, I think, in the beginning. But I think pretty soon, Nelly, after they were available, they were made available to any who came, right?
So with what Harmonia said, that's very true. The thing that I do know 100% is that there was no delay. We got help at the right time. There was no, some places actually felt like maybe they were even less privileged than Zambia was. Zambia were one of the countries that actually received the aid much, much faster, on time, and the rollout from the government was on time. The only issue we had was the acceptance from the community. It was quite delayed for them to accept. But the amount we actually got, the amount of support was really overwhelming. And up to now, when you look at it, there came a time even when there were shortages, but priorities with organizations, starting from UNC, and going all the way to places where there was COVAX. Zambia participated in a lot of vaccine trials. Harmony, we just completed COVID-PN for Moderna trial. So when it comes to availability, distribution, in terms of vaccination, vaccine availability, it was really, really, the support was enormous. I think most platforms will agree with that. The exact time when I say it was right, and you can understand, Kayla, the reason why people were a little bit hesitant in taking the vaccine was because of how fast they felt the vaccine came. So that's how much on time organizations came and addressed the situation at hand. That ordinary people felt this is a little bit tricky. Why has it come this fast? Because it was actually on time. And I'm thinking probably by 2021. I'm looking at 2021. I think 2021, beginning January, we're already doing this vaccination. What's this rollout? So even probably late 2020. It's possible somewhere maybe October, November, we got something, but it was never late. So knowing your questions, we can even help a little bit, but by having maybe one or two sentences typed in an email form, Kayla, if that would be necessary for you to to achieve whatever you need to do with this information. But otherwise, I think that's it for me. Yeah, thank you.
And is that the public health infrastructure in Zambia is actually very well set up for vaccine distribution and for rolling out programs like the vaccination program. So I would say that it's much better set up than the public health system in the US.
All right, thank you. Well, that was my last question. I wanted to thank you both for being here and doing this.
Sure. We're always happy to talk about Zambia, and we really appreciate, Dr. Nelly, that you joined us today and helped.
Yes, thank you. I really appreciate it.
Thank you for inviting me. Thank you so much.
All right.
All the best.
I appreciate it.
All the best.
Thank you.